Let's talk about sperm morphology and fertility outcomes. And this is a comparative study between ICSI, that's ICSI, and conventional IVF. So if you look at the sperm, let's look at the introduction to ICSI and IVF. ICSI is where you inject the sperm into the egg, and conventional IVF is where you mix the sperm in the egg after washing it. ICSI reduces the number of sperm needed for fertilization by injecting a single sperm directly into the egg, while IVF combines eggs and sperm in a cultured dish, requiring a higher sperm motility and quantity for success. Sperm morphology generally has been used for assessing fertility. Now, sperm morphology assesses shape, it tells us more about the structure, and we believe that maybe have a link in successful fertilization. Abnormal morphology can indicate underlying issues that may impact successful fertilization and subsequent pregnancy outcomes, making it vital assessment in fertility treatments. The study question is: does or can sperm morphology predict outcomes? So, this study investigates whether sperm morphology can serve as a reliable biomarker for identifying couples who may benefit from ICSI compared to IVF. Understanding a relationship may help us to identify how to treat patients. Previous randomized controlled trials have shown mixed results regarding the role of sperm morphology in predicting live birth rates among couples with normal sperm parameters. So, again, we're talking about normal sperm parameters. Recent findings suggest that sperm morphology may have limited value in guiding treatment decisions between IVF and ICSI. So when you look at the design, the secondary analysis of the RCT, this research is a secondary analysis of an open label multi-center randomized controlled trial comparing IVF with ICSI. It utilized data from 1064 couples with normal total sperm count and motility to assess the effectiveness of each method concerning sperm morphology. Eligible couples had a maximum of two previous IVF or ICSI treatments and male patterns with a normal total sperm count and motility, according to WHO guidelines. This selection ensured participants expressed a genuine infertility challenge while yielding to giving data. Data collection process was to standardize protocols maintaining across multiple centers. Sperm morphology assessments and clinical outcomes were recorded. Sperm morphology was assessed from a prepared sperm sample taken during the initial consultation, evaluated using a standard staining technique. This method allowed an accurate visualization of spermatozoa to determine normal morphology rates. Statistical analysis included logic regression, and this approach provided a comprehensive understanding of the relationship between the variables of the study. So, if you look at the main results, live birth rates recorded were 34.6% for for ICSI and 31.2% for IVF in couples with a normal sperm count and motility. Clinical pregnancy rates were similarly comparable, demonstrating no significant difference in outcome based on methods of fertilization. Total fertilization failure: remember, a proportion of IVF treatments will have no fertilization, was 5.5% for ICSI and 6.4% for IVF, indicating no significant difference between the two methods. These findings suggest that the choice of fertilization technique does not heavily impact on fertilization success in cases of normal sperm quality. What is the role of sperm morphology as a biomarker? Sperm morphology showed limited value as a biomarker in predicting outcomes for either ICSI or IVF, as no significant interaction was found. These results underline the importance of evaluating other factors alongside sperm morphologies, count, motility. The limitations of this study is that it may be underpowered due to relatively small number of cases. Additionally, sperm morphology was assessed at the initial consultation rather than at the point of treatment, which may again impact on accuracy. The findings do suggest that couples with normal sperm count and motility may not benefit from ICSI or IVF, emphasizing that IVF may be a more cost effective first line treatment. This allows us to make a more informed decision in those cases. So, that is in short about looking at sperm morphology and fertility outcomes and a comparative study between doing IVF and ICSI with men with a normal count and motility.